Good afternoon. I'd like to say thank you to the SAGES Committee for allowing us to present our work here at the World Congress of Endoscopic Surgery. The authors of this study have nothing to disclose. The background of our study is based on a perception that laparoscopic cholecystectomy can be performed safer in hospitals with resident training programs due to the presence of a resident assistant. We attempted to test this hypothesis by comparing bile duct injury rates between hospitals with and without surgical resident programs. Additionally, we compared conversion rates and mortality between the two groups. Our study was a retrospective review of the Florida State Inpatient Database. We attempted to capture all laparoscopic cholecystectomy procedures over a 10-year period. We used ICD-9 codes to extract and analyze our data, and subsequently used the SAS Institute software for analysis. Bile duct injury was identified by biliary reconstruction procedures performed on the same admission as a laparoscopic cholecystectomy. Bile duct reconstruction for cancer, inflammatory, or pancreaticobiliary conditions were excluded. Residency training programs were identified through the Electronic Residency Application Service, also known as ERIS. We then contacted, in an attempt to verify resident participation in hospitals, we contacted each Department of Surgery and Graduate Medical Education Office. Our data yielded a number roughly 231,000 laparoscopic cholecystectomy procedures. Of that number, roughly 8% were performed at teaching hospitals. Cholecystitis was a primary indication for surgery for all comers. We also identified 597 bile duct injuries within the group of patients. In the teaching hospitals, there were 43 with a bile duct injury rate of 0.24%. In the non-teaching hospital, we identified 554 with a bile duct injury rate of 0.26%. With the exception of the year 2003, bile duct injury rate remained relatively stable. Additional outcomes identified were conversion rates, which were statistically significant, 9.1 for Group 1 and 7.5% for Group 2. Mortality was equivalent between both groups. One unexpected finding in our study was that we found that a large proportion of our patients were admitted through the ER. Teaching hospitals over 50% and non-teaching hospitals over 60%. In conclusion, our data suggests that bile duct injury rates are not influenced by the presence of a surgical residency program. Conversion is more likely at institutions with surgical residency programs. Overall mortality rate is comparable. The majority of laparoscopic cholecystectomy patients today are now admitted through the emergency department. Thank you.